Play Pibaro, Ipinang Subhai Pi, Sakit Kami, Bakikubo, Baman Kasi.
Dr. Mukul Sangma, unangilam jong kaliang persya apo ke Sorkar Jela, haringkat ke jingdon ki weipat ki MLA na ke Kongres. Ulalej ban jureb ya ke Maternity Child Hospital ha umran yang bernai, bat kumju ya ke Civil Hospital hanong po, ya ke baka Sorkar Jela kelapan bena bikin longkum kita ke Jaka Sumar ki bapang COVID kat kendai. Ki balai senran lang hati ke sengi ki kentob yu ba Himalaya sang pliang, uzenet Sangma, uba Meral Bones im, uba George Billingdo ki bidegi MLA, nang tahu bak Charles Marngar bat ubak balajirani ki bidegi MDC ke Kongres. Kadba ni ki briu ko koit ke khial asakir ke jingdan lang Dr. ke Health Services MI, Dr. Amanwar, ke kong DM kurba, Deputy Commissioner ke Bhoi lembat ki wei. Lingba kate ke jinglet jurep u Dr. Mukul Sangma ulupan pau, ba umhun setia halor ke jingmen kre ke Sorkar Jela, ban penkela Jaka Sumari ki bapang COVID kat kendai ki artli ki Jaka. Markat hadu menta, ompat yu i setia ki dak, kisien ki baka Sorkar kala ban penjanai halor ke jingpen kela Jaka Sumar pang COVID kat kendai, ha ki Jaka. Bot ulak kenok ru, baka ne ke Sorkar MDA kala syusyukor ki pajba, klem datrei kumbala dep ban kular.
You see, we have been already briefed by the government on the measures already initiated and measures already put in place. And in our collective endeavor to fight against this COVID-19 pandemic, we have been visiting all the districts, particularly the facilities which has been created to fight against this pandemic, including the institutional COVID care centers, the community corona isolation center, the dedicated COVID-19 hospitals, and the kind of necessary infrastructure which are required to be ramped up, including the manpower related issues. Today we have visited that MCH hospital in Umrah. The work is still on. Hopefully they should expedite the whole process of this further finishing work of the infrastructure. But as of now, it's not operational. Now, the only facility which is available in Bhoi district is only this civil hospital in as far as treatment for the COVID patients are concerned. Now, after having seen and after having collected all the inputs here pertaining to the facilities available here, including the manpower, see, the facility available here is not enough to save lives. If these facilities would have been ramped up, including the manpower, we could have saved more lives. We have been, from the day one after seeing the death count, we have been very, very concerned about the very alarming number of death count. If you look at the positive cases, new cases on a daily basis, and the death count, it has been always on a higher side, 2.5% to 3% it went around, which is very, very high. Therefore, it was necessary for us to find out what exactly is the reason. There are a number of factors. One part is that the home isolation part and the delay in decision of the patient to actually shift the patient who require immediate hospitalization, the duration, in transferring the patient to a hospital. Another part is obviously whether in the hospital the right kind of intervention when the patients admitted in course of the progress of the disease start developing, if the cases ultimately turn into critical condition. I am very sad to see that other than civil hospital Shillong, none of the hospitals in the state can actually save the lives of the patients if they develop to more critical condition requiring ICU intervention. Number one, there is no manpower. So though we have the ventilators, though we have the ICU, they cannot be operationalized to save lives. We are very unfortunate to see that we have not been able to be ready. Doctors are here, they are trying their best. I can see the frustration amongst the frontline workers, because what is more frustrating to the frontline workers than seeing their patient succumbing. If they see fatality rate going up, it will obviously have toll on the frontline workers. They'll have real problem of stress and strain. And this is because the facility available, notwithstanding the manpower backup, there should have been people who can operate the ventilators. There should have been manpower put in place who could operate the ICUs to save lives whenever there is a critical case. But this is not happening. This has not yet happened. You cannot expect patients from Nongpo to be shifted to Shillong for further intervention when you're talking about saving a patient which has gone to a critical condition. So these are things which we have discussed. We will articulate them accordingly. The HODs are here. The DCs are now able to understand what are the deficiencies which are identified now, how we can actually ensure that these deficiencies are addressed at the earliest and save lives. That is one part, assuring of something to be done and assuring that something which is in the pipeline will be completed on time. That is one part. But is that whatever has been done and whatever, if you look at the oxygen plant which is being installed, hopefully it will be given by the superintendent of the civil hospital. But the fact is that if you do, based on the progression of the case, require more, just 3 patients will consume. You get my point now. This is the technical aspect. Just 3 patients can consume the whole oxygen. So what happens? Are we really prepared? No, we are not. That's why this is just an initial, probably intervention, but then we have to ramp up. You got my point. Only 3 patients will be able to be catered by this quantum of oxygen. Similar situation in other hospitals also. So anyway, we will keep on visiting and then we will keep on speaking to the government and then see that we all realign our focus, realign our strategy and see how we can put things in order. Everything should fall in line once we have a political will. So we will try to see that we have a collective political will and ensure that everything has fallen in line. We have to be very cautious because second wave is showing sign of flattening. But there are inputs to indicate that cases in the rural areas are increasing. Now, the number of positive cases on a daily basis may not be the correct picture because only if those likely positive cases in the rural areas are coming forward to get themselves tested, then only we will actually know the real picture, the real number of incidents. But in absence of that, we will always have a figure which is quite a deviation from the correct picture. And therefore, any likelihood of the third wave, we must be very, very cautious about them. We must ensure that we are able to prevent the severity of next wave, or if possible, prevent the next wave. We cannot prevent. We must be able to prevent wave so that we don't end up losing precious life. Thank you.